Welcome to Medical Marijuana and Wellness. Tonight's topic is fibromyalgia and medical marijuana, a medical condition that is painful, frustrating, one that causes a lot of anxiety and stress, and one that, quite frankly, sometimes is very hard to treat. And not only that, and also get diagnosed. We're going to talk today about it and dive into how medical cannabis has been shown to be able to address this particular condition and provide you a potential option. Now, I do want to point out this video is being made really for your information purposes. Naturally, if you want to have any medical conditions or talk about any medical conditions, please consult your doctor for any prescriptions that you may want to take a look at. But in the meantime, we do have a lot of good information that we'd like to present to you. I first of all like to introduce a couple of my co-hosts. One of them is Forrest Haag, who's from Surterra. Forrest, welcome. Thank you for joining us.
Hey, Mark, nice to be here again. Hi, everybody. My name is Forrest Haag. I am the product marketing manager for Surterra. I have a background in natural health and supplements, and for the past, I'd say, year and a half or so, I've been working on Surterra. Tonight, I have one of my favorite store managers with me, Manny Alfinez. Manny, introduce yourself.
Good evening, everybody. My name is Manny Alfinez. Thank you for joining us. I am the store manager of the Pensacola Wellness Center for Surterra, and I am also having a background in cannabis advising. And I'm looking forward to helping out and educating people tonight on fibromyalgia. Thanks for having us, Mark.
Great. Well, thank you. And Manny, you've working in the store, you do consultations with a lot of people, many of which have not only fibromyalgia, but other conditions. Is that correct?
Absolutely correct. And we offer consultations on a walk-in basis and as needed basis. We offer that amount of time for any patient that walks in through our doors.
Right. We've talked a lot about fibromyalgia, the medical benefits, how it works and how it doesn't work. Manny, rather than talking about theory, let's talk about some products that actually work, where patients, people watching this video, can go out and pick up products today to address fibromyalgia and get started on a journey to hopefully get their life back. What's your thoughts on that?
Absolutely. I would love to start discussing some products. There's quite a few that are out there. One of the things that is kind of ironic about this is usually when I do consultations or assist patients, I usually lean a lot towards CBD in recommending products. Fibromyalgia is one of the ones where I usually recommend more THC, particularly since it actually works with the CB1 receptors and it's affecting more of the spine and the brain, which is where your abundant of CB1 receptors are at. So as the slide came up, as you see the Surterra products for fibromyalgia, we kind of broke it down for some daytime wellness, afternoon, evening, and then evening and nighttime. And you'll notice there are some high CBD products on there between the afternoon and evening, but particularly one-to-one up to high THC. The reason that
we should point out that you've taken a look at a lot of studies and come up with these recommendations based on medical efficacy, and that's important. And then also, I think it's also important for people to understand if they want to know what terpenes are in each of these products, you have the certificate of analysis. Is that correct?
Absolutely. Upon request, we are working to get it more available, but you can get it upon request or even after the fact. You can go to our website, surterra.com, and at the bottom of the page, you could put in the batch ID number, which is on the product packaging, and then we'll send you that certificate of analysis as well. Yes, sir.
Yeah. And a lot of people will say, what are you talking about daytime, afternoon, evening? If you notice when we were presenting and we were looking at the different routes of administration, they have an onset time. How long does it take to work? For example, with a tincture, it might be anywhere between 15 minutes to 30 minutes, but also there's how long it works. It'll work between 4 to 6 hours. So if you take something in the morning, typically it's worn off by early evening. So if you have a situation like mine, where I have herniated discs in my neck, I have to look at a regime that works all day long, because if I take it in the morning, I'll start feeling bad in the evenings. And again, in fibromyalgia, it's not a condition that's going to go away. It's something you have to manage on a daily basis.
Absolutely. And to that point, as I was saying, when you have that high THC to kind of distract and help ease those symptoms, you still want to treat those symptoms in the peripherals, like difficulty sleeping, joint stiffness, headaches, IBS, and every other thing that comes with fibromyalgia. So that's why we still want to implement that CBD in a one-to-one or otherwise. So I guess I'll go ahead and go right into the daytime wellness products a little bit here.
Please.
We have the one-to-one Revive, which is primarily very heavy on limonene and alpha pinene. On that one, the only caveat I would mention is that if you're going to take it, make sure you have something ready to do. It's kind of like taking an energy drink, if you would, and then if you don't have anything to do, you may get a little anxious or paranoid. So that's definitely one to get things done. The 5-to-1 Serene is more for that focus and energy. Definitely helps with depression, stress, and anxiety. The more you take it, the more it'll help with inflammation, but that may not necessarily be the cause of your fibromyalgia or the symptoms of it. The 19-to-1 Tranquil is a really high CBD one. That's more going to be just to kind of relax and soothe yourself, find physical and mental peace. That comes in tincture oils. Most of the CBD products are going to come in tincture oils, edibles, or orals rather than inhalation because it naturally crystallizes. So just be mindful. If you do get it in a form where it is liquid, you don't want to store it for too long because it will crystallize. One of our favorites, 1-to-1 Flaming Cherries, 1-to-1 meaning 50% CBD and a 50% THC, is a really good one for the daytime because of the terpene profile. Doesn't give you that lethargic feeling or spacey feeling. It does alleviate mood, and that does come in vapes and concentrates as well. Papadon is usually a strain-based product, one of our great flowers. Highly recommended during the daytime for flower pre-rolls, vapes, and concentrates. And the reason I mentioned concentrates is kind of important because one of the cannabinoids that really helps with fibromyalgia is THCV. However, you can only really get that if you're reaching high temperatures, and hence you get that from concentrates and doing dabs. However, I do want to warn you, don't necessarily need to get over 500 degrees. As you mentioned previously, that's when you start burning off those terpene profiles and getting a little bit more than what you wanted to bite off on that. So I usually keep it around 400 to 500 to reach THCV, which is also, when you get hungry, it suppresses your hunger.
It suppresses your appetite. Yeah, I found that I've been advised that like 425 is a good temperature setting on your concentrate pen, or even if you're smoking flower on your dryer vaporizer, that's a pretty good temperature. But I also want to point out, each of these products have these terpenes, the caryophyllene, limonene, myrcene, and linalool, right?
Absolutely. And the main ones, as you can see on the side there, B-caryophyllene, one of my favorite natural analgesic pain blocker. It also reacts with your CB1 and CB2 receptors, kind of like your cannabinoids. Limonene is a great one for mood, uplifting, not too energetic. I do caution persons if you're using sativa products with limonene, watch out for the pinene. Too much limonene with pinene kind of gives that energetic feeling. That's what's in Revive, and that's why that happens. Myrcene is a great one that actually kind of permeates the blood-brain barrier, allowing more THC in, which is what's going to help with fibromyalgia primarily. Also predominantly found in indica strains, which are more relaxing and sedative. And then this little baby brother, as they call it, linalool, kind of elevates mood and relieves stress.
Sure.
The reason I like it is it's kind of a contraindication there. It elevates mood, but it's sedative in properties. And if you think about it, have you ever felt so good where you just relaxed and kind of chilled? That's kind of where that goes to. Elevated mood, but nice and relaxed and sedative, where you could possibly go to sleep more naturally.
Sure. This is great. Now, tell me about afternoon and early evenings.
So the afternoons and early evenings, we have a 12.5-to-1 Calm, which is a classic, I like to call it, because it's a sought-after one that will help with your overall well-being. That's not going to get you euphoric or high or stone. And the terpene profile on that won't necessarily put you to sleep. So it's a great all-around daytime one. However, it can relax you enough where you kind of want to sit back a little bit. That's why I listed it in the afternoon and evenings. 1-to-1 is Super Glue is Flaming Cherry's cousin. That one's more for the afternoon. Its terpene profile suggests that it will help you kind of relax rather than Flaming Cherries will uplift you. PB and Smelly is a relatively new strain developed with Surterra that we put out. Usually comes in high THC percentages, which is going to be beneficial again for fibromyalgia. Uplifted mental state, but physical relaxation, which is going to be really good for that spasticity. And then Bittersweet is more of a nice balanced hybrid that gives you a slight uplift, so it keeps you more focused during the day if you don't want to relax. And those are our flowers, and then those also come in concentrates as well.
Right. And then, of course, in the evening time, evening time is really important because I think a lot of people don't realize that you've got to do something, especially with fibromyalgia, because you have it basically all day long. It's not going to go away. So you need to have something in the morning, the evening, the afternoon, late afternoons, and then also in the evenings and also nighttime. I think it's really, really critical.
Absolutely. We always try to mitigate the day to kind of invoke a more natural sleep at night. The more natural your sleep is, the better your day tends to turn out. One of my favorite products that I recommend pretty much to all of our patients that come in is our one-to-one soothe, because it's so high in that caryophyllene terpene profile, which reacts with our receptors, natural analgesic. It's great on the gut, so it really helps with that. And it really does help with inflammation and pain. And it's good all around one. Most people compare it to maybe a few glasses of wine if you drink wine, or maybe a shot of alcohol if you're a bourbon or liquor drinker. So it's really a good one, and that's also a nice segue as how cannabis relates to alcohol, as you mentioned before, that biphasic effect where less is more. You kind of have to be disciplined. As soon as you start feeling good or feeling nice, or however you want to categorize it, that's when you need to stop and see how far that'll carry you. And when that starts wearing away, then you want to go back in for more. And that's really important because you don't want to increase your tolerance when you have to chase that effect either, particularly if you're going after THCV and using concentrates at high temperatures. That's where the one-to-ones and CBD comes in, mitigates that tolerance for you. The next one-to-9 relief, is formulated just like our one-to-9 dream. However, its terpene profile suggests that it's going to be better for pain and sleep, whereas Dream 1-9 is more for a racing mind and sleep that way. So definitely 1-9 is going to be beneficial. And then Truffle Breath and Rainbow Harbor are flowers for that.
Okay, that's great. Well, you have these products in your dispensary, and I think if you are a fibromyalgia patient, it's really good to be able to take advantage of these to get some relief. But I think more importantly than just the products themselves, patients can get a consultation from you. And I think this is important. Whether you're a new medical marijuana patient or an experienced medical marijuana patient, consultation really helps because it, first of all, helps you identify the terpenes and the routes of administration that make sense for you. But I think also there's a lot of new products that have come out probably over the last couple of years, that because I see a lot of them new on this particular list from Surterra that people may want to take advantage of and may not know about.
Absolutely. And it's super important to have that consultation, because then you're not guessing at what you're purchasing and hoping it'll work. We could kind of direct you. Obviously, we can't guarantee it. But then we could also ask some more detailed questions. As your presentation showed, our endocannabinoid system produces endocannabinoids, our natural internal pharmacy, if you will, just like hormones. And there are suggestions that cannabinoids are there to kind of help balance out those hormones, which balance out our homeostasis, which also suggests why fibromyalgia is more common in women who also commonly have more hormonal imbalances. So when you put these things together and we can ask these questions, have you had this in the past? Okay, then we could guide you towards a better product because of your history as well.
Right, right. I think this is important. I think if you walk away from this understanding just a couple of real key things. First of all, there are products available. There's consultation that you can talk to someone to get help. And also, really, you've got to be able to go low and go slow. Find your tolerance to THC. Once you do that, you can really home in on the relief. I know that I had severe pain in my neck. Once I started getting the relief, it was like, whoa, this is better than any pharma drug or anything else that I had. And I had to find that I did go over. I did take a little bit more than I should, and I began to feel uncomfortable, began to feel dizzy and things like that. And I just backed down, just went down to my therapeutic level, increased the amount of CBD, and really was able to home in on a product that really for the last 2 to 3 years has been able to help me quite a bit.
Absolutely. To that point, when it comes to the different routes of administration, I know there's a lot of patients out there that are reluctant to smoke for whatever reasons, or to vape for specific reasons because of fear of what may be contained in the product. One thing I would like to suggest that if you're gonna, well, first off, there is liability at a dispensary, state and other regulatory processes for that to show on the certificate of analysis there are no heavy metals, there are no pesticides, mycotoxins or such. But the other thing is inhalation is the easiest way to try and dose, because if you don't like the effect, it's probably going to stay there for maybe an hour and a half, 2 hours. Whereas if you ingest it and you don't like the effect, you're then stuck with that effect for 4 to 6 hours, if not more, unless you have CBD to kind of help mitigate that effect. So I just suggest that to keep your mind open for possibly vaping or smoking. There are, like mentioned before, there are the dry herb vaporizers,
Right.
so you don't have to combust product as well.
And also the concentrates have some great concentrate pens, which I really enjoy, like Puffco, and you're able to set the temperature setting. I love my Puffco Plus. It's really something that helps quite a bit. So there are treatment options. That's what I'm trying to point out. So take this very seriously, because I know patients that have tried a lot of pharma drugs, really wasn't as effective. They've tried medical cannabis, and in fact, last week I had a couple of people tell me that it's really helped them really get their life back quite a bit. So Manny,
Significant.
let's jump into some questions. Prior to this webinar, everybody had the option of being able to set some questions. Let's kind of jump into that. And by the way, we should point out, please go to Surterra.com for the web form and sign up for your 10% discount. First one is, can you suggest a strain for fibromyalgia that does not induce hunger? This is the famous munchies issue, and I think this is very personalized. Is that safe to say, Manny?
I think so. It's also a very difficult one because everybody's digestive system is different. But there are suggestions that indicas or products with high myrcene, linalool that are relaxing tend to induce that hunger, because as you're relaxing, more blood gets to the gut, induces hunger. So I would stick with high caryophyllene products, or hybrids typically have that. Some of the ones I mentioned, Papa Don, Peanut PB and Smelly are two strains. Both one
Right.
Papa Don's a sativa, PB and Smelly is more of a hybrid or indica leaning hybrid.
Great. Yeah, I think, again, in talking to the bud tender, they'll be able to direct you to these particular products. And again, pay attention to caryophyllene and beta caryophyllene. That can help quite a bit.
And this is why journaling is so important, because if you remember what you had last time that induced that and you bring it to us, we can actually bring up the certificate of analysis from that, kind of delineate which terpenes are causing this and kind of avoid that in the future.
Sure. And I can tell you, as a medical practitioner, when I'm working with patients, having a journal really helps, because I'll ask patients, what did you take? When did you take it? And they really don't remember, or they don't know. And that makes it hard to be able to find out what that pattern is that either worked or didn't work for you that's out there. And journaling isn't really difficult, but it does help quite a bit. I know I wasn't a person that was big on journaling, but I finally, when I had that major injury, I started journaling. It made a big difference in me being able to find very quickly what my tolerance was to THC and to find my therapeutic relief level. Second question is, I'm unable to tolerate the side effects of medical cannabis. I don't smoke or drink alcoholic beverages. Does this mean my tolerance is the problem? This goes back to dosing. This goes back to remember we talked about every person's body is different. Just like with alcohol, just like with caffeine, every person's body tolerates medical cannabis differently. Some people, like my wife, has a very low tolerance to THC. Now, she reacts very well with CBD products. And in particular case, we're addressing stress and anxiety. She's able to use a high CBD, low THC product. So I think what you're really trying to find here is that therapeutic level. I think if you can, once you know where your tolerance is to THC, you can then increase the amount of CBD. And I think that will help you quite a bit. I don't think you have a problem. I think what you have is something that's very natural as a human being, to being able to identify what what works for your body, what doesn't work for your body. Your thoughts on that, Manny?
I completely agree. This is where the consultations really come into effect, because I would have to find out what methods of administration were used, what dosage, what products. But to your point, there are people out there with a hypersensitivity to cannabis, and that's where we would mitigate with more CBD, kind of create a so-called cocktail, if you will, where you would take CBD first, kind of prime those receptors, back them up a little bit, and then a little bit of THC, and find that perfect match and balance that works.
Right. I think that's really great. Now, today, the next question addresses something interesting. It says, is the same set of products, cultivars and terpenes, used to treat neuropathy and pain? How does that work? Well, how does it work? I'm going to go back to talking about I did some slides on what's the big deal about cannabis, where we talked about the nervous system and the endocannabinoid system. And I think I'd have you go revert to that to really understand that. But I think the main problem with neuropathy is the sheath on the nerve is really exposed, meaning that you really need to get a neuroprotectant, which is what CBD does. So is it the same set of products? Pretty close to the same set of products. I think that in the case of neuropathy, we lean more towards products that are high in CBD, but you still have to have a THC level that's there to address the pain. And I think that's really, really important. That's a good slide. Thank you, Lee, for putting this up. What I want to point out here is that you can see that when you're looking at your body, you have CBD and THC receptors. What you really want to be able to do is be able to find what really works for you. And I think that's what's really, really key. Your thoughts on that, Manny?
I agree. The only difference typically would be that if depending on the pain versus neuropathy, which is painful, is it chronic pain? Is it joint pain? Is it something other? Because we also use topicals to treat certain pains, whereas neuropathy is a little bit trickier like that with that, because the topical can actually induce that pain or make it worse. So we'd have to be cautious.
Yeah, coming up in the future, in about 4 weeks, we have a webinar on neuropathy. Please join us for that. There's 6 different types of neuropathy, and we'll be addressing it then. But the answer is pretty close, but not exact. And that's why we do these webinars, to be able to let you home in on exactly the products that help you that are there. Now, next question I have here is, can I find the best route and strains that help with pain and exhaustion and have a life? The answer is yes. I think that goes back to your being able to find out what your tolerance level is for medical cannabis. Because I know that once you find out what your tolerance is, and also remember, your route of administration is something that you're comfortable using. If you're comfortable smoking cannabis, you can use a concentrate pen, a high dry herb vaporizer, something like that. If you're not comfortable with that, don't use them. You have products that are tinctures, you have edibles, you have topicals that can help you quite a bit. So I think that how you find that is to go low and go slow. But again, this goes back to the consultation. Is that correct, Manny?
It is 100% correct. And if you're a new patient and you're just starting out, you should have 5 routes of administration, or 6 technically: oral, sublingual, topical, edible, inhalation, and then the smokable route. And I would suggest, unless you are 100% sure you're not going to use one of those routes, accept them all for your first certification, so we could find out what routes, what strains, what cultivars or such are going to be beneficial. And then upon your next recertification, or sometime in the middle, if you need to, you can always call your physician, have that discussion, and say, you know what, I'm not using this route. Can we move these milligrams over somewhere else? So that way you have more availability to you at your leisure.
Yeah. And I think what you're talking about, Manny, is when you go to the medical marijuana doctor towards the end of the visit, they'll ask you what routes of administration you use. Just tell them all. Okay, just accept them all, because you don't, until you really have experience with them, don't limit yourself as something that may turn out to be your go-to product.
Correct. And there shouldn't be a price difference for all routes or otherwise, depending, I would imagine. But going back from time to time, there may be a clinical fee or such. It just depends on the clinic.
Right. Good question is the next one is, can I use edibles or tinctures instead of flower for fibromyalgia? The answer is absolutely. Your thoughts, Manny?
100%. You just want to be mindful of the onset and the duration. Anytime you're going to use edibles or tinctures, again, I always make sure to throw out that caveat: go low, go slow. As you said, Mark, just about the time you don't think it's going to work and you take another one, it will kick in. The other difference is anytime you're using the sublinguals, you want to hold under the tongue as much as possible, at least 45 seconds, so you can get that sublingual absorption about 60%. Or you can mix it with something fatty. I also tell people, if you're not mixing it with anything, have a small snack right before or a big meal after, so it attaches. That's why you find edibles typically in fatty materials, chocolates, cookies, and such like that.
Yeah, and there are some doctors that will tell you that you can not only just put the sublingual drops under your tongue, you can swish it around your mouth, because what you're really trying to do is get the receptors within your body, within your mouth, to be able to absorb that tincture drop and really get it into the bloodstream that's there. But the answer is yes, absolutely. And I look, you look at the duration of edibles, the 4 to 10 hours, same thing with capsules. They're very effective. Like if you want to sleep at night, edibles are going to be much better option than smoking if you want to sleep through the night if you have fibromyalgia. No question. I mean, a brownie, a lozenge, or a gummy, something like that could help you. So the answer is yes, you can. And it is, again, what works for you is going to be very personalized, but I wouldn't rule out the tincture drops, capsules, and really the topicals to help you. You not have to go flower. It's there. Next question is, what strains work best for fibromyalgia? I think we covered a lot of that, didn't we?
Yeah, I hit a couple of those. Papa Don, PB and Smiley are the two, sativa, and then hybrid indica are the two primaries that I usually recommend if in stock. And if they're not, then we'll delineate during your consultation which ones are going to be the closest or comparable.
But I do want to say, I want to have you not focus on strains. Focus on the terpenes, because the terpenes are what give cannabis medical value. And I think people pay too much attention to strains. We call them cultivars. Cultivars are the strains, the terpenes, and the flavonoids that are engineered to help you with a particular condition. And if you pay attention to the terpenes, you'll get a cultivar, which is a strain, terpene, and flavonoid that really is going to help address your particular condition. Your thoughts on that, Manny? Because I think really
Yeah,
cultivars and paying attention to terpenes are really the key here.
absolutely. And I'm glad you included me on this one because I like to use a little metaphor on this one, my spaghetti and meatballs metaphor. Everybody has their favorite restaurant or pizza joint or wherever they go for a specific meal. And that's because of how they make it and what ingredients they use. And just like any spaghetti and meatball dish, you're going to get served spaghetti from the same dish and meatballs from the same dish, your CBD and THC, if you will. However, that sauce, whether it's red marinara or white vodka sauce, is what determines how it smells, looks, and tastes, just like terpenes do for cannabis.
Right.
So knowing that terpene profile is going to make a difference, just not that strain name.
Right, can help you quite a bit. And I know in many cases when I've talked to folks using medical cannabis and say it doesn't work, I've looked at what they're using and the terpene profile doesn't match up or doesn't provide relief for the condition that they're trying to address. I think that's really, really important too. And again, the consultations bring a lot of that out. This also addresses the next question. Is there a certain strain to help with pain relief? We did a webinar a couple of weeks ago on pain management. And really, you're looking at beta-caryophyllene as the terpene for that. Is that correct?
100%. Your natural analgesic it reacts with both receptors more commonly than any other terpene, just like cannabinoids. And again, you could typically find those in hybrids. Another telltale sign is if your nose is tingling or you're sneezing after using the product, particularly inhalation, it's typically indicative of having high caryophyllene, as is predominantly found in black peppercorn.
Right, right. It's there. So I'd say rather than focusing on the strain, focus on the terpene, and you'll probably get the pain relief that you're looking for. That's really there. That's really, really important. Do you know a brand of CBD or CBN? How do you know a brand of CBD and CBN is a quality brand? First, I want to mention that here in the state of Florida, and with almost every medical marijuana program across the United States, Eastern Seaboard, Western Seaboard, whatever, you have to have certificates of analysis. You have to do two tests internally and one test from an external third-party source, and be able to pass before it's actually a product that you can sell, which I would say helps to guarantee or be able to promote the brand quality. That's what's really, really important. So do I know of a brand? I would say, let's start with Surterra. You want to talk about that, Manny?
Absolutely. So again, the certificates of analysis, pretty much any dispensary in the state of Florida. But again, you still have specific cultivators at each dispensary that does certain jobs, just like you have different chefs at different restaurants. So CBN is actually a little bit different and a little bit more difficult to cultivate. It is also the so-called degradation of THC. So THC doesn't necessarily degrade. It does, but over a specific time, it transitions first into CBN, then it degrades. So you'll have a brand of CBN or CBD of quality if you just ask the questions, look at the certificate of analysis. And if you're getting it from Surterra, I could pretty much guarantee it.
Yeah, and again, you have your COAs are available to the patients. I think that's important to point out. So do I know of a brand? Yes, the answer is Surterra. And again, almost any dispensary that's medical marijuana dispensary approved by any state should be able to follow that formula of testing in-house. Is there a pure CBD available? Hold on here. Is there pure CBD available as to not cause panic attacks from THC? You can pure CBD or CBD with very low or almost no THC is called broad spectrum CBD. And My Botanical Wellness sells those products and they are available to you. So the first thing is, yes, they are. You can get it from My Botanical Wellness and you get broad spectrum products. They work very well. Now, I do have to point out a little bit of THC triggers what's called the entourage effect. And if you're worried about panic attacks, the amount of THC in CBD, 0.3% or less, should not trigger a panic attack. Again, every person's body is different, so I'm not going to say it's 100%, but you could also use what they call full spectrum, which means 0.3% THC or less in CBD. That would really help quite a bit. And I think also if you have high, and again, My Botanical Wellness gives you the CBD products, but I think also if you have high in CBD, low in THC, like 20 to 1s and 12 to 1s product, or 19 to 1s and 12 to 1 products, that'll help quite a bit as well. And Manny, you have some products in that category, right?
Absolutely. We have as you mentioned, 12.5 to 1 calm and the 19 to 1 tranquil. One rule of thumb is as you're looking at ratio-based products, usually in the state of Florida, the first number is your CBD, the second number is going to be your THC. And anytime you have more CBD to THC, the less euphoric it is, the greater the number of the CBD is. Now, as you get closer to that 1-to-1 or more THC, that's when it becomes more euphoric, psychoactive, and you want to be cautious. But typically, the terpene profiles will also play a role in that. So we want to take a look at what products you're using that's causing those panic attacks, so
Right.
we can actually dissect it.
Right. I think that's important. I hope that answers that question. I think there's a couple of different approaches, both using a high CBD ratioed product and also with pure CBD products. Now, the next question is, THC makes my anxiety worse. Is that common? Is there any way around that? First of all, THC can make your anxiety worse, especially if you're taking more THC than your body is able to absorb. When we talk about going low and going slow, I'll just use tincture drop as an example, or better yet, a gummy. If you take a gummy and you cut it into quarters, just break it down and try the quarter. Hopefully that you'll see if that works or not. Does it give you the relief that you're looking for? And again, are you getting anxious? This may be an issue, not just that THC, but it might have to do with finding out your therapeutic dosing level and the ratio of CBD to THC that you need to be able to address your situation. Your thoughts on that, Manny?
I'd agree with you on that one, Mark. Again, you could preload with CBD and then take some THC afterwards to see if that makes a difference. It's all about balancing it out. It's suggested that the average dose is 5 to 12 milligrams, which is why you see, or excuse me, 7 to 12, and which is why you see most edibles and so forth at 5 to 10 milligrams. And then again, you could take little bits. You want to make sure that whatever you're taking as an edible is homogenized, like our wanna chews, because otherwise you could cut it in half and you don't know if all the medicine's in one side, one quarter, or the other. So you want to make sure it's homogenized, just like our wanna chews. And you can start off with high CBD products and work your way up that way.
Yeah, I think the answer to this question is pay attention to high CBD products, and really start there, because they won't give you that anxiety, or should not give you that anxiety. And then you can actually go from, let's say, a 19 to 1 to maybe a 9 to 1 or something like that, just to see if the difference is really there. Test it out, but use it in low quantities so you don't really get that anxious effect that you're really looking for. This has goes back
Another,
to
I was just going to suggest another part to that, Mark, is what is your location? What do you do? There's a lot of outside sources that can play a role on that. And if you get into that situation again, what I found useful after I retired from the military is I wrote a little note to myself saying, hey, you're legal, you have a license, this is making you better. such and
Right.
such. And by the time I got done reading that, I started feeling better, if not already feeling better. And then that side effect didn't happen anymore because your body got acclimated to it.
Right. That's a good point. The anxiety can come from a factor that doesn't have to do with cannabis, it just has to do with the environment. I think that's what's really, really important. Um, Second question is, what helps with fibromyalgia flare-ups? What is the best intake method? Well, I have found that if you think of this like taking multivitamins, you take it continually because what it does, it gives your body, in essence, gives your body the endocannabinoids that it needs or the phytocannabinoids to make up for the endocannabinoids that are not in your body at that particular time, both due to age and basically because you got to be able to produce them for any particular effect. Now, if you pay attention to using, let's say, a CBD product, a high CBD product, what it's going to do is it's going to preload your body and really try to avoid a lot of those flare-ups. Let's put it that way. This isn't like a pharma drug that you take 2 pills and call you in the morning. This is more like a multivitamin that you take on a regular basis. And what it does, it gives your body the material it needs to be able to address that. Now, Manny, there are also some different intake methods that are here. And my advice to anyone looking at intake methods is do one that you will use. If you'll eat edibles, that's great. If you like capsules, that's great. If you don't like smoking, that's great too. But I think the real issue boils down to, what will take effect immediately? What are you looking for as far as time, as far as the effect and the duration? Your thoughts on this, Manny?
Absolutely would go with sublinguals and inhalation for flare-ups.
Hmm.
They're the most rapid onset. The inhalations usually within 5 minutes, the sublinguals within 15 to 20 minutes. However, if you are, as you suggested, taking at least a 1-to-1 daily, whether you need it or not, that should help mitigate a lot of the flare-ups because that's more in your peripherals, and that CBD should help take care of that or mitigate that at the very least. And then you would use the THC or high THC products, whether sublingual or inhalation, for those flare-ups if they happen, because that's what's going to get that immediate effect in there right away.
But I think your point about really flower or taking an inhalation method, whether that's a concentrate flower or a vape pen or a sublingual, would probably be the best that's out there. And then also, I would not rule out some topical. Your thoughts?
If it's a transdermal, yeah.
Yeah, absolutely. It'll be something that will help you quite a bit. And it's amazing how quickly these transdermal patches or these transdermal products work. So pay attention to them as well. So there's a number of different options that you have. Use a product that you will use. Some people, if you're not an inhalation person, don't use it. You have other options. That's what makes medical cannabis great. You have options.
And
Especially,
keep in mind, Surterra actually, if you're a first-time patient, we have a 60% discount up to $250. The idea is to get the things that you're interested in that's been directed by your physician and
Mhm.
based off of the consultation with the guide. So that way you can try things out, journal it, come back and use your second time discount to get what works. And hopefully by the third time, we have you on a nice routine.
Right. And this is something that you really got to try. This is something you really got to work through. Now, people say it's different from pharma drugs. The answer really it isn't. When a doctor prescribes 2 pills and says, call me in the morning, he's giving you the lowest possible dosage and hoping like hell it works. And if it doesn't work, then you've got to have a lot of phone calls with the doctor and hopefully get the adjustments that are there. And that's why sometimes even the pharma drugs don't work. So in this case, you have control versus working through a third party to help you figure out what's going on. You still can get consultations. Let's go to the next question. This is, do you have stats on outcomes and or successes? And the answer is, when we went through all of the different studies that were there, you saw that the studies would say 1/3 of the patients or 60% of the patients or the majority of the patients, meaning 80% of the patients or more. The answer is almost all of the studies give the outcomes and the successes that are there. We have that slide on successes. When we finish this webinar, you'll be getting an email that'll have a copy of a link to the video, copy of a link to the questions, question and answer period, also a copy of these slides. In that slides, take a look at the different studies that were done. They'll be able to really help you address the outcomes that are there. The worst case that I saw of the studies that were there was a 30% positive success rate using medical cannabis, which, by the way, when you compare that to pharma studies, is a pretty good rate. Your thoughts, Manny?
I don't particularly have outsourced statistics. However, from the patients that come through the dispensary in Pensacola, we find that most of them are typically unsuccessful until they actually have a consultation. At that point, they spent hundreds, if not thousands of dollars and have shelves full of products that they can't use. However, during the consultation, we can actually go back into the past and see what was purchased and then tell you how to use that product or otherwise. And after that fact, if they've gotten a consultation, again, to your point, usually about 30 to 45% come back with reviews of how it's improved to a certain extent.
Right. Great. So the next question is, how can I target fibromyalgia pain in my neck, back, shoulders, and also neuropathy in my hands and feet? Besides taking the products we talked about, the tinctures, and whether you like tinctures, edibles, or flour, I recommend using topicals. I know that I have pain in my hands just from, candidly, age, and also because I use them all the time, and the keyboards, and when I play golf, and a number of other things that I do. So I have found that topicals, and especially transdermals, really help me quite a bit. And I would say, in fact, one of the products that you have, Manny, is the balm. I have found helps quite a bit with my hands, and also with my knees. Your thoughts?
Yeah, absolutely. The fixed balm is one of our greatest products. Everybody comes back. Actually, I haven't had one single person who hasn't said that it assisted them to a certain degree. So if you're definitely trying to target any pain, whether it's fibromyalgia or otherwise, topicals are a great source, particularly balms and salves for joint pain. And then we have lotions for more of the muscle aches and surface level aches and pains. The transdermal patches are great. Most of our transdermal patches are systemic, and it's such a small dose that you may feel something, but it shouldn't interfere or impede your regular day activities.
Sure. So I think I would say the answer is yes, and pay attention to the topicals. Again, feel free to go to a Surterra store and get a consultation, or just talk to the person behind the counter. I think they can help you with that. Next question is, can medical marijuana help with kidney disease? If so, what kind should I take? I'm going to answer this in two different parts. First of all, can medical marijuana help with kidney disease? It can, but it depends on the disease, what's caused it, how far along it is. There's a number of issues that, as a medical practitioner, I have a ton of questions to really, before I can answer that question definitively, that I would want to know. And I think this is where you talk to your medical marijuana doctor, talk to your doctor, and also get a consultation from the dispensaries. What kind should you take? It really depends on what is the cause of the kidney disease itself. It usually comes from something, and if you can cut that off, or you can treat that, it'll really help you with that. But this is such a broad question. I would say this really requires the next step of talking to a medical professional to really help you with this. I can't give you an off the cuff answer. I can just give you the off the cuff answer that I've seen medical cannabis, and I've seen studies of medical cannabis help with various kidney diseases. But again, we really have to dig down to really address your particular issue. Your thoughts, Manny?
Yeah, that's one that's above my level. So I'll just take your word on that one, Mark.
Again, I've seen studies that work. We need to know what the cause is, where you are, how far along you are, and where it is. And I think this is where you really need medical advice. And I don't want to steer you in a direction that's not going to help you. Talk to your medical marijuana doctor, talk to a practitioner, and again, get some help when you're if you go to a dispensary, they'll actually guide you into products that can help with kidneys. It says, I am already on a medication for pain. Should I contact my doctor as well? Related, discuss dosing and potential drug interactions. Anytime you're taking any medication and you're working with a doctor, I would say yes. Talk to your doctor about it. Now, when you talk to your doctor about it, there are doctors that are open to using medical cannabis, and there are doctors that are not. My doctor, for example, was not open to using medical cannabis, primarily because he never was studied it. He didn't know anything about the endocannabinoid system. He never knew anything about medical cannabis. And as a medical professional, he didn't want to make any recommendations or comment about something he knew nothing about. So guess what I did? I dropped it. Okay. I mean, I need somebody who's going to work with me. And I'm defending him from the standpoint that these doctors really don't know. They weren't taught the endocannabinoid system in school. But a lot of doctors, in fact, we found out that over 40% of the doctors now are studying and getting to know the endocannabinoid system. So find someone who plays in that particular party. So the answer is, first of all, yes, let your doctor know, but you can use medical cannabis. The only time you have to worry about medical cannabis is if you have a condition that's related to blood, like blood thinners, or something that's a condition of the heart. Other than that, you should not really have any interactions that are there. But again, let your doctor know. I have one patient that I'm working with right now that actually doesn't have a problem with his cannabis interactions, but he has actually he's taking 4 different drugs from his doctor, and two of those drugs are basically fighting each other. It has nothing to do with cannabis. The pharma drugs are the problem. It's not the cannabis. So really pay attention to what you're taking, read the labels, talk to your doctor, and if nothing else, get a cannabis practitioner to help you in this particular area. Your thoughts, Manny?
Yeah, I couldn't have said it better. Other than in the MMUR, they used to put in that MMUR is a medical marijuana use registry, which is regulating the licensing here in Florida. And some physicians, depending on what the situation is or depending on the conversation with the patient, will put in a recommendation in the notes there. So that way we're aware to help guide you as well, and you don't have to re-explain or reinvent the wheel with us. But we always suggest or always push to have that conversation with the physician, make sure they're aware. Our employees in the dispensary are not medical professionals. We're subject matter experts in cannabis within our dispensary, particularly. So we won't hand out any information like that or suggest any information besides talking to a physician.
Sure. Now, the next question is an interesting one. How much does it cost to get a card and keep buying medical cannabis? Here in the state of Florida, you have to get a medical marijuana card. The process to do that is to find a clinic that prescribes these cards. The state of Florida requires that you do a medical visit. You do a visit the first 6 months of the year and the second 6 months of the year. So you're going to have to pay a physician twice during the year to do a medical checkup. And they run anywhere between $280 per visit all the way up to, I've seen sometimes $600 per visit. The ones we recommend, the one I recommend, MMTC, is somewhere between $199 to $299, depending on location and the state that you're in and that type of thing. Now, the other thing you have to do is, just like you get a driver's license, you have to get a card from the state of Florida. So there's another $77 charge for that. So it typically costs, just a ballpark figure, around $500 a year to maintain a card. Why is it so expensive? Well, you can thank Rick Scott for that. When we were bringing the medical program into Florida, he wanted to make it as difficult as he could for people to be able to get a card. He jacked the prices up by requiring the medical visits that are out there and a number of other things. So the answer is yes, it's expensive. We've been working a lot to try to get those costs down, but again, it's something that put into the system, and I'm not happy about it, but it is unfortunately something that you really need to have. Now, the other side of it is, if you look at $500 as a copay, that's usually a lot less than you copay for a lot of other drugs that are out there. So it's interesting to see how it all plays out. Your thoughts on that, Manny?
I completely agree. There's not much else I can say to that, except for on the dispensary side. We do have programs to help it make it a little bit more affordable. We have discounts. We have a point system. For every dollar you spend, you get a point. So many points, you get a stackable discount. So there are different options out there, and there's certain discounts such as veteran discount, industry discount, first responder discount, stuff like that. So inquire when you come in to see us.
First time user discounts.
Yep, 60%, 40% your second time. There's a student discount. So if you're in school and you're a student, we'll help you out with that as well.
You can mitigate the cost with that. Okay.
Mm-hmm.
So hopefully that'll be able to help. Now, the next question is, does medical marijuana affect AFib? The answer is, medical cannabis goes through the bloodstream in your body. That's how it's transported. The answer is, it does have an effect. Anytime you're using any product that has to do with the heart and the bloodstream, please consult your medical doctor as well as your medical marijuana doctor. You can use cannabis when you have a heart condition. What you do is you adjust the dosing levels on both the products that you're taking as well as medical cannabis to really get it into that area where they're complementary and they're working together. So the answer is yes, it affects them. My recommendation is talk to your doctor and your medical marijuana doctor. Your thoughts, Manny?
Yeah, that again, that one's a little bit above my head, but from some of the studies I've read, I would agree with you on that one. Although you're the more of the subject matter expert than I am.
Yeah, well, again, it's something that, yeah, when you use the word affect, the answer is yes, can affect it positively or negatively. But again, I've seen patients, I work with patients that have heart conditions, but again, we make sure we have the appropriate dosing levels on both sides, both the pharma drugs as well as the medical cannabis, to really keep the patient safe. And I think that's really, really important. How do you accumulate comorbidities such as MCAS, mast cell activation syndrome, where the body is more reactory to medications, including cannabis? Um, I've not really addressed this one head on, and I'm not seeing studies in this particular area. Although I will now that you brought this up, I'll go take a look at that. But I do know that the best way to be able to know how your body is doing is using a dosing regime called go low and go slow. Again, it's not a matter of just not only the MCAS, but it's also how your body reacts to that. There's two different variables that are moving to be able to find out what works for you. Um, if your body is very sensitive to medications, which some people are, I have one person who I know is actually in the medical cannabis field that is very sensitive to medications. He had to be very careful when he's going through his dosing to get that right. And again, go low, go slow, and I would say journal, and that'll help you figure out what can work for your body and what can't work for your body, especially if you're sensitive to medications. Your thoughts on that, Manny?
Yeah, this is a clear case or a clear example of where we would look for those notes in the MMUR. If the person came in with that recommendation to use cannabis and is looking for advice on this, we would suggest the same thing, very low and slow. We would start off with high CBD initially and then work our way from there.
Right. I think because the CBD will help in a lot of different areas, not just the endocannabinoid system, but also your chances of having a negative reaction is a lot less with high CBD products. Now, if you have fibromyalgia in the mix here, then you typically need some CBD products, which is why you want to look at a medical cannabis product. But again, a high ratio product is probably going to be the way you want to go. What are the most effective routes of administration for short-term and long-term management of fibromyalgia? Do you want to attack this one, Manny? Because this falls into your product category.
Yeah, absolutely. So the most effective routes short term are typically going to be your inhalants. They're fast in, fast out. The one caveat to that, or the one nice balance between that and edibles and orals and topicals for that matter for short term, is the sublinguals. The sublinguals do have a quicker onset than most edibles or orals, and they last a longer time, 4 to 6 hours. Whereas if you took a capsule, maybe even a chocolate, it might last a little bit longer, but that's also going to be based on dosing. So long term, edibles, ingestibles are going to get in your system, last longer, particularly CBD. Takes a few weeks, maybe a week or two, if not more, to really build up in the system for that long-term effect. And once you build up CBD, depending on your symptoms, you'll notice you won't need THC as much. In this instance, for fibromyalgia, it's kind of hit and miss because the THC is really what's most beneficial, and the CBD, from my experience with patients, is more for the flare-ups or to mitigate the flare-ups. So I would suggest just having a vape if you're vaping, or dry herb vaping or smoking available, as well as maybe some gummies or Theragels, the capsule form, so that way you're always prepared. Also keep in mind our Wanna Chews, which is available, are melt proof, which is really cool here in Florida because they're made with pectin instead of gluten. So that's something that you can have available with you here in Florida just to help mitigate and have that long-term and or short-term effect.
Sure, that's really great. Now, the next question is kind of interesting. It says, is medical marijuana useful for central pain syndrome and regional pain syndrome? Point blank, medical cannabis is very good for pain. Is that safe to say, Manny?
100%.
Yeah, and there's been a lot of different studies, and plus, just candidly, a lot of folks that have found that that's really the case. Now, as far as central and regional pain, this is where you really want to take a look at what products you're going to use. Should you use a topical? Should you use a gummy? Really, it really depends on you, and it depends on how your body reacts to this. The answer is yes, very effective for pain. I would say that if you're looking at a regional pain type of a thing, shoulder, an arm, a knee, this is where topicals can really help quite a bit. When you're looking for central pain type of thing, this is where you may want to take a look more of your gummies, your capsules, tinctures. Your thoughts, Manny?
I completely agree. This is one of the situations where I usually start off with, say, a 5-to-1, 1-to-1, so a higher CBD and work your way up again, low and slow.
Right.
For your central pain, regional pain, the topicals, 100% agree.
Yeah, that's something that's there. Okay, let's run up to the next question here. Okay, now this is questions from that been asked during the webinar. We finished all the pre-questions. Now we're getting into the questions that you've been asked as we're going along. First question is, can you take a doctor's prescription for depression and migraines along with THC? The answer is yes, but again, it's a matter of THC and also having some CBD that's there and being able to work with your doctor on those particular prescriptions. There should not be a really a reaction that you have to them. Again, cannabis works with almost all pharma drugs, except for you got to be careful that what exception is with the bloodstream and the heart. But I do want to make sure that your doctor knows, and that, again, you're going low and going slow to make sure that you're not getting a negative side effects. Your thoughts, Manny?
Yeah, for particularly depression and migraines, I've actually found that higher CBD and particularly certain terpene profiles work great for that. For instance, our Serene 5-to-1 ratio based product is amazing for depression, non-euphoric, great daytime focus product. And then migraines, our 1-to-1 Soothe is really good for that. So you have products available for the daytime, not too euphoric or psychoactive. And then you, of course, have the high THC products that'll work for that. I've used some things for depression, post PTSD and stuff where I've kind of mitigated that with cannabis. And in doing so, like you suggested, Mark, I worked with my physician and making sure that I didn't do things wrong, because when you're working with depression, particularly, it could put you in a spiral and you don't want to do that. So be very cautious, low and slow.
Yeah, exactly where you don't want to be. This next question is right up your alley. Jess says, how do you know the terpenes in your medical marijuana? I purchase from Surterra, and I get tinctures and gel capsules that have names like Revive, Soothe, and Dream. This is right up your alley.
Yeah. Oh, awesome slide. I love this. So this is a chart that shows every terpene in its dominant perspective area. As you can see in Revive, that pinene and limonene, pinene being prominent and then limonene being second. That's what induces that energetic feeling. High CBD, great daytime product, but not too euphoric. The Serene 5-to-1, my favorite, even though myrcene, indicative of a indica profile, is first, it's followed by that high profile of limonene, which is why it balances out for focus and clarity. And then that eucalyptol really helps with that, even though it's a minute amount.
Mhm.
The Soothe is the last one I want to go into before we go into more questions. That's the one I really like and recommend for most people. As you can see, that B-caryophyllene is dominant. It's amazing. Then it's followed by limonene and pinene, which doesn't put you to sleep, as I suggested with Revive, gives you that energy. But then it's followed by myrcene, which is counteracting that. So it's not too energetic. It's not too relaxing. It's more social, like people suggested, a few glasses of wine. And that's how you could delineate those things. One last point, you mentioned that you were getting tinctures and gel capsules, what we call our TheraGels. Tinctures, if you don't hold it long enough in your mouth, when you swallow it, being that terpenes are so volatile, they're destroyed in the stomach and you lose that driving force. Whereas if you hold it in your mouth, you're getting that, you get that driving force. The TheraGels have an outer shell that break down from the stomach acid and then 90% absorption within the gut. So you're actually getting those terpene profiles with an edible or an oral like the TheraGels, which is significantly more impactful and great for nighttime, particularly dream or relief, depending on your symptoms.
Good answer. That's there. Anonymous asks a question. It says, I work and run meetings during the day, so I have to be very productive. What can I take so that there's no chance I'll feel high? I can relate to that. I mean, I have meetings almost all day. I really can't be high. I guess I could, but it's something that I do have to address my pain. I typically lean towards a higher CBD ratio product because that'll give me a lot of the relief from the pain, because it relieves a lot of the inflammation. It reduces the inflammation, which relieves the pain. I would say heading in that particular direction on high CBD product would probably be the best way to go. That's exactly what I do. Your thoughts, Manny?
I agree. My favorite is Serene. I take the TheraGels for focus, clarity, It literally, for me, takes the stack of meetings or interviews or whatever I have going on during the day and lays it out so I can kind of just figure out how I want to approach this, and makes it so less daunting, if you will.
Mhm.
Depending on the person, though, some people have a tolerance where they function very well on high THC products. So it really depends on the person and what you're looking to accomplish. But I would suggest highly high CBD, serene being my favorite.
Good point. Next question is a really good one. It says, I personally haven't found effects from taking CBD tinctures on fibro pain. I've heard from a friend that I have to take CBD for a while before I've noticed any difference. Is that true? Number one, if you're looking at taking a medical cannabis product for fibromyalgia, you have to have a certain amount of THC in there. If you're taking a CBD product, a broad spectrum product with little or no THC in there, it's not going to help you. And in fact, candidly, CBD products with full spectrum 0.3% THC really are not going to be as effective for fibromyalgia as you may like. It'll reduce the inflammation. It'll start to address the pain, but it's not going to take that pain and get rid of it head on. You've got to have a medical marijuana product that really has the THC and the CBD that are there. Now, that's on what kind of product you should be taking. I think you might be taking the wrong product, is what I'm saying. You need to add some THC to your formula to address fibromyalgia. Second part of your question is, should you take CBD for a while? Does it help? The answer is yes. Again, like a multivitamin, it helps to charge or basically put the phytocannabinoids in your body that you need to be able to address your particular condition. Your thoughts on that, Manny? Because I do think having some THC is going to be critical. CBD only is really not going to be the answer.
Yeah, this actually plays into what I mentioned before. Typically, I always lean towards one-to-ones or higher CBD and work way up to THC. With fibro, I typically one-to-one or higher THC and try to work it back down to CBD as the symptoms or the flare-ups or whatever it may be are lessened. So definitely, at least I would say maybe even a 2-to-1 or something with some THC for that onset effect or synergistic effect is beneficial.
Yeah, a higher ratio is CBD to THC product, but THC is critical to address your fibromyalgia. That's really what's out there. Susan says, which of these Surterra products have the terpene humulene to suppress appetite? Are myrcene and linalool recommended or to avoid? I would not avoid myrcene and linalool. I think they're really great products but they do have their effects. I mean, linalool will really relax you. Myrcene will help to help your cannabinoids, your cannabinoids be absorbed into your body. But so I wouldn't avoid them. I would say, but use them for the reasons that they're produced and what they do best. Now, as far as terpenes and humulines, I'll let you. That's right up your alley.
Yeah, humulene is actually a harder terpene to find in a dominant form. It's usually very minute in most products. However, off the top of my head, I can't think of any we have just off the top. This kind of threw me for a curve, so I apologize, Susan. But I wouldn't avoid myrcene or linalool either. You want to make sure that you have that biphasic effect, or as Marc said, that sweet spot just right. As soon as you start feeling just about where you think you're going to start feeling really good, stop. It's usually the overuse or underuse that's giving you those side effects.
Right.
And particularly in myrcene and linalool, if you take too much of that, kind of get couch locked, more blood flows to your major organs, making you kind of hungry.
Right. Yeah. So I think again, the dosing becomes into play. How much you take. Key to medical cannabis: more is not better. Okay, this isn't like I take a half an eyedropper, so I'll take a whole eyedropper. Be very careful. You want to stay to that really dosing level so you don't get into that area where you feel uncomfortable or it's not really providing the relief that you're looking for. Joanne asked the question: are these strains available in dispensaries in Philadelphia or PA? Really, again, I'm going to go back to what I mentioned earlier. Pay attention to the terpenes. The terpenes are available in dispensaries in PA, and if you go to the dispensary, ask the person behind the counter. They should be able to direct you to products that have those terpene profiles. That'll direct you to the strains in that particular state or that particular dispensary that can really help you. I tend to look more for the terpenes than the strains. Your thoughts, Manny?
To give you an example of that, unless Well, there's no interstate or commerce, so I can't import export different products from different states right now. It's federally illegal. However, seeds are getting across state lines. If I take a seed from one location and grew it here in Florida, even though the genetics are the same, it wouldn't be the same product. I could still call it Granddaddy Purple, but it may not have the same effects growing it here than it did in PA. So always ask for that certificate of analysis. Check out those terpene profiles. Usually list at least the top 6 or 7, if not all of them. And don't be surprised if you see it less than 2% total, because terpenes are a very small percentage, usually somewhere between, I would say, 0.8 and 3.7% of the total product.
Yeah, they may be a small percentage, but they have a huge effect. A little goes a long way.
Absolutely.
Let's put it that way. Cheryl, I think this is more of a comment than a question. It says, I am new to medical marijuana scene. As a product of the 1970s, I have found that there is so much more benefit besides just getting buds. I've learned so much from these webinars. Well, first of all, thank you. I'm glad you're getting a lot out of these webinars. We do this for one reason, that's to help people get their lives back. And if I can help just one person tonight get their life back, then this has been worth it. I agree. I'm a product actually of the 60s. And I just finished a class reunion where we talked to a number of friends of mine who were absolutely fascinated. I'm in the medical cannabis business because cannabis is more than just getting buzzed. This is where people can get their life back. This is where they can feel good. You get into a state of homeostasis. The pain levels go down, if not go away. Your anxiety levels go down. You're able to enjoy your life. I think this is really something that's really out there. So, Cheryl, thank you for the comments. And hopefully we help to get your life back, and we can help anyone watching now get their life back.
If I may, Mark, for
Sure.
Susan, the humulene, I think Forrest just posted up in the chat, if you're curious, some strains that we have available that contain humulene. Thank you, Forrest.
Yeah, there. Joanne asked a really good question. She says, when I go to a dispensary, I don't order a vape, et cetera, by terpene, but by strain. And I've noticed that many of the salespeople not that well versed on THC strains that they have, especially based on terpene profiles. This is unfortunately one of the things that's going on in our industry right now, is just the amount of knowledge that you have to have about the products. And in defense of the bud tenders, there's a lot of products on the shelf. It's hard to remember what's in every one of them. That's really an issue that's out there. We're doing some things to address that, hopefully in the near future. But the point is, right now, that is difficult. I think the key is, though, really, and I'll use Surterra as an example. You've spent a lot of time at your dispensary really training people on terpenes. In fact, you just had a terpenes seminar at your local dispensary to me last Sunday.
Yep, we have another one coming up this Sunday, the 29th, I believe is the date, from 2 to 3 p.m. There are certain locations throughout the state doing that. If you don't have our app, please download it. You'll be able to find it there. And in the same respect to that, Ms. Joanne, one of the benefits that you have at a local grocery store that you don't have at a dispensary, unfortunately, is that you could taste the fruit before you buy it. You could buy grapes or whatever fruit from your local supermarket and it tastes delicious. You go back and get that same batch a week later, it's not as delicious. It's just a natural growing plant. And even if we could remember the multitude of terpenes, it would change from batch to batch. So to the benefit of yourself and the med tenders or the guides or the bud tenders, the easiest way is simply ask, what is the terpene profile of your favorite product or products? And we would be happy to bring those up, because not only are we showing you, we are also learning ourselves for while that batch lasts in our inventory, and we won't have to go back and look every time. But we also at Surterra have a little shortcut on our back computer where we could bring up our strains and give you a general synopsis of what those terpenes would be. If you want specific percentages, that's when we would pull the COA for you.
And I have to say, not all dispensaries do this. Not all dispensaries really spend a lot of time paying attention to terpenes and training their salespeople. And again, that in my mind, there's a lot of dispensaries out there. Which are the ones that I feel are my go-tos? It's the ones that really address these kinds of issues. I think that's the best way of my personal opinion. Susan asked a question. Last question we have. My eyes, mouth, and skin on my face literally dry up when I partake in medical marijuana. Is there a terpene I can avoid to help with this, or anything else I can do to keep this from happening? Your thoughts on this, Manny?
That's a great question. I would have to get a few more details, what products are being used. This sounds like it's pretty generalized.
Yeah.
But I would also need to know if it's just flower you're smoking, because then you could possibly vape flower, or you could try a sublingual for a semi-rapid effect but lasts longer. A consultation would be your best bet, Ms. Susan. Come in wherever you're at in the state of Florida, look up your closest Surterra. I guarantee you, anybody there will find somebody that can help you, because that's the beauty of our dispensaries. We're not subject matter experts on everything within the dispensary. Most of us are patients as well, which is why we have our favorites. Me particularly, I like sativas or hybrid sativas. So if somebody was asking me about an indica category, I would ask somebody else in the dispensary I work at, hey, you're better at this. You mind if we switch out, or would you like to work with this person and get a better consultation? So that's where your benefit would be, or that's where you would be most beneficial, is getting that consultation with us.
Yeah. And I have to tell you, I'm not familiar with any terpene that has this particular characteristic. However, every person is different. And as we mentioned, it's a very personalized experience. In any medication that you take addressing your particular medical condition is a personalized experience, whether it's pharma drugs or cannabis. But I'd say I'm not aware of anything, but it may have to do with what you're taking, how you're taking it, and again, the consultation is absolutely the best way to go. I think that's going to be the thing that's going to help you quite a bit, because I do know that people get dry mouth. That's fair to say. Is that right? Manny?
Yeah, dry mouth, cotton mouth, certain aspects like that. And there's a lot of suggestions as why that happens. Me personally, I always carry a little bit of water, a bottle of water, something around, just in case I get the munchies sometimes. If I'm trying a new chemovar or cultivar, typically what happens is your body is reacting to something that's different. And
Mhm.
as you take whatever mitigating standpoints you need to, drinking water, if you become anxious, reading a note to yourself, whatever it may be, after a time period, your body will acclimate and become tolerant to that.
Right.
And to that point, you may need to even switch to a different product within the same terpene profile, so you keep your body guessing, because our bodies are very resilient. They're remarkable. They become very tolerant once we get them where they need to be. And we just want to balance out that homeostasis. So again, that consultation would be most beneficial.
Yeah, and I do want to point out, drink water with anything that you do, whether it's athletically, even during the day, especially here in Florida where it's hot. Water is really a key part of being able to help your body to be able to address any particular issues that you're really addressing, that you're really trying to treat that's out there. Manny, we've gone through a lot of questions. We've gone through a lot of material. We also have a lot of resources that are here. I know that if you're looking for a card, we have medical marijuana treatment clinics you can really address. You folks can look at. Surterra, you do a great job, Manny, and thank you very much. I want to ask you if you have any last comments, because I think your consultations, the quality of your products, the ratios, and the breadth of your product line really helps a lot of people.
Absolutely. I greatly appreciate that, Mark, and thank you for having us. One thing I will like to impart on everybody before we do get out of here is definitely check out our wellness line. It's the most consistent within the state. And if we could figure out, based on terpene profiles on our wellness line, we could kind of show you the world of cannabis. The last thing also is that or second to last thing, any Surterra will be able to help you, whether it's the manager, store manager, a guide, a lead. We're all there as a team to help out. And then lastly is our terpene profiles for this evening that I wanted to point out was caryophyllene, limonene, myrcene, and linalool. Those are the four terpenes that I found to be more prominent. And then the last one that was brought up that wasn't on the slide is humulene this evening. So lastly, again, caryophyllene, limonene, myrcene, and linalool are the four terpenes I would recommend this evening for fibromyalgia.
Yeah. Now, I do think I want to cover these last 2 points about the botanical wellness for CBD product, and of course, have everybody. And again, I do want to finalize our last slide. Please check out our YouTube channel. They really help you with being able to not only address fibromyalgia, but how to use it, where to use it, and potentially other medical conditions. Final thoughts for us that you have on this?
A lot of really good information tonight. A lot of go slow, start low and go slow. You know, you hear that a lot with us. We actually just launched these treatment journals in all of our locations, so you can really start low, go slow, start to document your journey and really find out what works for you. I have sciatica, for instance, so all things nerve pain really relate to me. So I started journaling, really finding out what terpenes really work for me, which ones don't, which give me anxiety. And you really need that journal to go back to it. So I would definitely suggest that everybody absolutely do that. Surterra actually, we dispense more CBD than any other dispensary in the state, which is great. So as Manny said, come and check out our wellness line and everything that we've been talking about tonight. That's how we really got started. And we don't have the most stores in the state, but we definitely do. We dispense the most CBD because really these products are built to last for sure.
Well, and then the ratio products, you take a look at all the ratio products. Most of the people that are taking THC will put it with a ratio product, whether that's 1-to-1, 5-to-1, or 19-to-1. Yeah, great. So, Forrest, thank you very much. Thank you for the coupons and for being here and helping sponsoring the webinar. Manny, your thoughts?
I pretty much concluded it. I greatly appreciate the time. I hope somebody learns something. Again, come out and see us. We're happy to assist. Otherwise, I hope everybody has a beautiful evening.
Great. Well, I'd like to thank everybody. I know we've lost a lot of the folks. We've been on this for an hour and a half, and I want to thank the folks that are still here for participating. Hopefully, you got information that'll help you get your life back. That's what this is really all about. Check out our YouTube channel, marijuanaaware.com. It hopefully will provide some information for you. We have upcoming webinars that are coming up on PTS, neuropathy, and a number of different subjects. Please join us for those. And I hope that everybody stays well. I want to give a special shout out to Lee and Leah in the background that have really helped do a lot of the background, and Alyssa Quintana, who is the person who really came up with and the idea of this particular webinar series. So listen, thank you everybody for joining us. And I hope to see you at the next webinar in 2 weeks on PTS. And again, Manny and Forrest, thank you very much for your help. Much appreciated. And everybody have a nice evening and more importantly, a safe and healthy weekend. Thank you.